Hello and welcome to the City of Reading Mental Health Series. Tonight we have our fourth and final session. It is going to be based on the topic of substance use disorders. And before we begin, we have a few words and some personal words from our mayor, Mr. Eddie Morán. Mr. Mayor?
Good evening, Mr. Butler and everyone. Today, as you're going to hear, is our final series of four different series that we had. Our last one today, which again, I have to acknowledge the sponsors and those that made it possible, such as the African American Community Connections, the Lonnie Walker Foundation, as well as myself, Mayor of this great city of Reading, Eddie Morán. Tonight's topic is the truth about substance use, abuse, and recovery. So with that said, I want to give once again a special thanks to Mr. Wynton Butler, the Honorable Judge Tanya Butler, and tonight's panelists, Mr. Hamilton Newton, my very good friend, to say the least, Dr. Alberto Figueroa, Sabrina Key, and Cicely Holston. I also want to thank somebody that we have not thanked publicly enough, and that is our very own and very special Mr. Christian Crespo, City of Reading Communications Coordinator, who has been behind the scenes making all of these episodes possible, to been on the social media and managing it in the background. So again, Mr. Crespo, thank you to you. To our audience from Reading and any part in the world watching online, I hope tonight's discussion provides you with the tools and resources to understand, identify, and overcome any struggles you or someone you know may be experiencing with a substance. I'm going to ask you to please share this right now. You know, one of the side effects of the pandemic is that it has sorry, I lost my train of thought. The struggles have been that someone that has been experiencing substance abuse due to the pandemic, because of the situations such as isolation, depression, and the lack of resources to manage different state of mind, turning several people to various coping methods at really alarming rates, such as excessive alcohol consumption, opiate use, and other substances. You know, I share this because I know this as a mayor, as a father, and actually as recovering alcoholic myself. I normally don't talk about this, not because I'm embarrassed or because um, don't feel that it's important. It's because I only do so when I feel it's needed, when it's going to help somebody else. Only by the grace of God, I currently been celebrated 15 years of sobriety. For me, it always started with a beer, and knowing that my father died from alcoholism, I was at first very concerned of how much alcohol I would consume. But being raised in the 80s, then alcohol turned to other substances, and it was very challenging, not only for me, but for those surrounding me, my family that loved me. And, obviously I didn't want to hear it from anybody because I knew better. I knew it all. I've always been able to maintain employment, thanks God, and was even a cop for a short period of time in New York City, but yet didn't know how to cope with my own demons, and only until I decided to get help, both professional and from those that knew better than I, ways to deal with situations such as the one that I was confronted. And actually, let me share, you know, I feel so bad for my wife because my wife was there day in, day out, uh, through it all. And only unto my 5-year-olds, one of my twins, they were 5 years old, saw me come home one day, and I will always bring them a toy or lollipop or something. And one day I forgot, but yet I had a bag in my hand. And when I got home, he told me, Dad, what do you bring today? And I realized that I had not bought him or them the candy that or even a fruit that I would bring on a daily basis. And I said, oh my God, Poppy, I forgot today. I'm so sorry. He goes, what's in the bag? He goes, oh, wait, I know, beer. And I'm sorry.
It's all right. That's all right.
Thank you. Thank you.
That came from a 5-year-old. So if we think that our children are not seeing what we doing and what we going through, we still align to ourselves. So please forgive me. I wasn't even sure that I was going to share this until the last minute today. But again, it was important that I did, to let anybody that's listening that you too can do it. You know, there is life, and there are so many ways to choose a better way, to do better, and to be a better person. Thank God I found that. Who would have ever known? You know, here I am as mayor of the 4th largest city in the Commonwealth, that if I would have kept on the way I was, probably would have never happened. So I'm grateful. I'm grateful that, you know, I don't know, I might have spoken to somebody. I might have seen something. I listened to my son, to say the least, because that's when he started to come to realization that I needed to make a difference. So I encourage you to please listen carefully to all the panelists that are going to be talking today, to learn any signs, and most importantly, to use this information to overcome anything you're going through. As the mayor of this beautiful city, I definitely can share that I believe in you. I believe in second chances, and that anything is possible when we do our part to do it a better way. So, you know, I don't want to make this about me. There's some amazing individuals that are going to be sharing today, and I thank you for that. But know that if anybody heard what I had to share today and feel that they would like to talk to me personally about it, again, I would never deny that fact and be more than willing to assist in any which way I can on a personal level. Thank you guys. And again, forgive me if I got a little emotional there.
No, thank you, Mr.
Thank
Mayor.
you.
That's exactly what we need. People that are transparent and that share and are willing to reach out. And we can't expect any more of you. And thank you. That was very appropriate and really kicks us off with a nice message. So thank you. What I want to do next is introduce our panel. And I have to give my wife credit. She was able to get a hold of all these fine individuals. And I am just so happy that you're able to take part. But I want to make sure as she told me, I better get this right so that you guys gave her good information. But I think it is very important that we get this information out. So first, I want to start with Cicely Holston, who is the owner of Phoenix Wellness, LLC. She's in the private counseling practice. She's been working with at-risk youth and families for the last 6 years. She's been an MST therapist, working with substance use disorder clients, and drug and alcohol counselor in an inpatient setting. And she is currently working as a drug and alcohol counselor, running an IOP program, conducting individual and family counseling in an outpatient setting. Cicely has received her master's degree in clinical mental health counseling from Kutztown University. That's right, she's a golden bear. And she is currently pursuing her PhD in counseling education. And that's Ms. Cicely Holston. Also joining us is Sabrina Key, a licensed professional counselor and certified addictions counselor in Pennsylvania, who's been in practice or working for the last 27 years of experience with adults, adolescents, and seeking those folks that are seeking help with depression, anxiety, and adjustments, and self-esteem and addiction issues. Sabrina's experience working with forensics population, JPO, PO, CYS, DV, and as she's assisted with anger management, conflict resolution, parenting education, and empowerment and advocacy. So thank you for joining us, Sabrina. And also, Dr. Alberto Figueroa is a bilingual licensed professional counselor. Let me say that again, a bilingual professional licensed counselor worth their weight in gold right now in our city, and a certified family therapist. And he is a clinical director of an outpatient mental health clinic, offering therapeutic services through a virtual counseling agency. Also works as a behavioral specialist for adults with autism. Man, that's enough right there. But Dr. Figueroa is also proffered services to individuals living with mental health and substance use disorders in Berks County for nearly 17 years. Just fantastic work. And last but not least, Mr. Hamilton Newton, also known as DJ H. Vidal, is a person long-term recovery. Hamilton's been a media personality, DJ, entertainer for over 30 years. He can be heard on Reading's first and only hip hop station, Loud Radio, PA, right here in Berks County, the Lehigh Valley, makes 88.9. Also makes 88.9 in Lynchburg, Virginia. Sir Hamilton is also a voice actor and a branding voice for various radio stations and TV affiliates all over the country. His professional background also includes certified recovery coach and working in case management and the Hope Rescue Mission, and Easy Does It. The resumes were unbelievable. And what I want to do is sort of kick this off by having Hamilton, who we had, I've known him all his life, but I didn't know any of the things I just read. So I'm excited to actually give him a chance to share a little bit with our audience. Hamilton, what is, well, why don't you just tell us a little bit of your story? Why don't we start there?
Oh, wow. Well, thank you. First and foremost, thank you, Mr. Butler, for the amazing introduction. Thank you, Mayor Eddie Morán, for sharing your story. And lastly, a big thank you to all of the panelists and esteemed colleagues that are on here today. Thank you all so much. And I'm just grateful to be here. A little bit about myself. My name's Hamilton Newton, as Mr. Butler had shared, and I'm a person in long-term recovery. And what that means for me is I have not had a drink, drug, pill, or fix since September 27th, 2014. And as a direct result of that, my life is great today. You know, I'm trusted. I'm a much better father. I'm a productive member of society. You know, I get to spend time with my family. I get to work. You know, there's a lot of things that I get to do. And I'm just so grateful for that. A little bit about myself. I'm born and raised in Reading, Pennsylvania. Grew up in the 6th Ward, 3rd and Walnut. I was raised by my grandmother, Shirley Newton. And I'm the oldest of 3. I have 2 younger brothers. And my mother was a heroin addict. My mother I have since lost. And my mother was a heroin addict. And while she was carrying me, she was in active addiction. So the process pretty much started before I was even entered into this world. Never met my father, and I'll get into that a little bit later. But my mother had carried me. I was born into the world. Me and my brothers grew up. My mother was in and out of prison, you know, throughout my entire life for the most part, or mostly my childhood. My grandmother then put me and my brothers into Milton Hershey School. We stayed in Milton Hershey School for about 8 years or so. Then came home from Milton Hershey my freshman year of high school. That's when I began my my red knight career. Went to Southwest and then Reading High School. My mother was then released from Muncie State Correctional Facility, and she was touched by some beautiful women from the prison society back then. I believe it was Freedom Gate, way back in the day. And Freedom Gate will always hold a very special place in my heart. But that's where the seed of recovery was placed for it in my mother while she was in prison. And when she was released, she made a decision, conscious decision, to turn her life and her will over to the care of God. And she changed her life around. She got a job. She sobered up. And then shortly thereafter, we were hit with some news that my mother was diagnosed HIV positive. She then succumbed to the AIDS virus in 1992. So my mother was released in 88, and I was just getting to know my mother. And as I was getting to know my mother, I lost her 3 to 4 years later. So what that did for me was I became a young man with mommy issues. I was angry. I was angry at my mom. I was angry at my higher power, who I choose to call God. Because my thought process was, well, you took my mom away from me. She changed her life. She's not getting high. She's not getting drugged. She's not using drugs anymore. She's out of prison. Why should I believe in anything else? So I became this angry young man, and I started acting out in behavior. So there was a behavior that was planted in me. I did not know how to treat women. I did not know how to be a good husband. And I became a very self-centered, angry person. And in order for me to cope with that, I would turn to the substances. So that's just a little bit of a background as far as my past is concerned.
Thank you. Man, like I said, that's a lot to unpack. But what I want to do is we go through this is to make it more of a discussion. I want to remind our audience that our Q&A box is open, that you're allowed to ask questions, and we're going to try to answer them as best we can. And hopefully, hearing some of these details, or sometimes intimate details about even Hamilton or even the mayor, maybe that might trigger a question in yourself or make you reach out. But what I want to do next is bring Dr. Al Figueroa into this discussion, and maybe he could tell us what the substance use disorders sort of look like. And I know you have your own personal story, but maybe even with the 2 stories you've heard already, if you wanted to point some things out.
Thank you. Thank you very much. Good evening, everyone. I'm Dr. Figueroa, and before I begin, I just want to welcome all of those who have made the decision or taken the opportunity and the time to be present for this presentation. I also want to thank Major Eddie Morán. Thank you for sharing. Thank you for presenting, and thank you for being a part of this presentation. And thank you also to the Honorable Judge Tanya Butler for inviting us, for having us to share our experience, strength, our knowledge and expertise on the topic of substance use disorders and abuse and addiction. In this part of the segment, I wanted to talk about, I wanted to provide a brief presentation of substance use disorders and addiction. And for clarification purposes, the term addiction will loosely be used here, since we will be talking or speaking about specifically the obsessive and compulsive misuse of drugs and alcohol. I will also wanted to provide just a brief personal experience with addiction and some tools that I have found helpful in maintaining my recovery. And so to begin, I just wanted to talk about what is or what are substance use disorders. And a substance use disorder is a mental health disorder or a mental illness that affects person's brain and behavior. Substance use disorders lead to an inability to control mind and mood altering chemicals and manifesting itself in the individual's thoughts, feelings, and behaviors. Substance use disorders occur when this continued use of alcohol and drugs causes what we consider clinically significant impairment, which includes health problems, disabilities, failure to meet responsibilities at work, at school, in the relationships that one has. So according to the National Institute of Drug Abuse, addiction is a chronic disease that is difficult to control. It's marked by changes in behaviors caused by changes in the brain after continued substance use. In the DSM-5, or the Diagnostic and Statistical Manual of Mental Health Disorders, 5th edition, is a publication of the American Psychiatric Association that provides classifications of mental health disorders used by medical and mental health professionals within the United States. And in the DSM-5, substance use disorders are identified by examining the presence of 11 characteristics or symptoms that lead to clinically significant impairment, which occur within a period of about 12 months. The severity of the substance use disorder is assessed by identifying how many of these symptoms are present in the individual's life. For instance, if they're experiencing 2 or 3 of these symptoms, we'll consider it mild. If they're experiencing 4 or 5 of these symptoms, we'll consider it moderate. And 6 and above, we consider it severe. And it's important to know the severity level of the substance use disorder, because it can help professionals determine the best course of treatment that the individual who is struggling with the substance use or misuse disorder is needed. And so I'm going to label each one of these symptoms, but it's important, while I review the symptoms, please consider or reflect on them in the event that you know a family member or a friend, or even if yourself is experiencing any of these symptoms, because it's imperative that we seek the assistance from a mental health or drug and alcohol professional. And just to note, as I identify these symptoms, I'm going to use the term use or using, which will refer to drugs and alcohol, since we'll be examining mind and mood altering chemicals. The first one is unintended increase or prolonged use. 2, an inability to reduce or stop using. 3, spending a lot of time getting, using, or recovering from drugs. 4, experiencing cravings and urges to use. 5, using is causing unmanageability at work, home, or school. 6, continued using in spite of adverse consequences in relationships. 7, giving up important social, occupational, or recreational activities because of using. 8, using again and again, even when there is a risk of danger. 9, continuing to use even when you are aware of the physical and psychological harm that could be caused or made worse. 10, increased tolerance, which simply means needing more to achieve the same effect. And 11, physical dependence, needing the use to relieve withdrawal symptoms. These are the 11 characteristics that we identify when someone comes into our offices and addresses that they're having some concerns with themselves and the use of drugs, alcohol, or any other mind and mood altering substances. And so I often get asked what causes addiction. And to date, there is no specific identifiable cause for addiction. However, there are 3 identified contributing factors that help us to take a look at what could be promoting it. And so one of the factors is what we call the genetic predisposition. And 40% to 60% of the research literature just simply states that some individuals appear to be more prone to becoming addicts than others. However, they haven't come up with what we call an addict gene as of yet. The second would be the environmental influences. And for some, being raised in environments that present drug use as a pleasurable experience tends to normalize the experience. In other instances, it has been found that traumatic upbringings have been correlated with the increased likelihood of individuals becoming addicted. And the third factor is what we call the biological factor. I've tried to make this in as simplest terms as possible. Whenever we do something that's pleasurable, something that we enjoy, something that feels good, our brain reacts chemically and encourages us to do it again. This is a natural process. However, when we use mind and mood altering chemicals unnaturally this unnaturally causes our brain to react. The unnatural process tends to overwhelm the brain, minimizing the natural reaction. With continued and prolonged use, the brain becomes dependent on the mind and mood-altering chemical to produce the feel-good experience. And then what happens is the amount that was initially used to produce the experience is no longer sufficient. And so the individual then finds that necessity to continue coming back for more. And in my personal experience, I wanted to just touch a little bit, on my experience with substance use. And in my experience as an individual living with a substance use disorder and currently in the process of recovery for over 19 years, I recall I began using at the age of 12 years old. And I did not stop this disastrous and uncontrollable journey until I was 38 years old. I found myself homeless, unemployed, unemployable, desperate. I lost everything that had value to me. I lost everything that I'd say validated my existence, but most of all, I had lost my dignity and my self-respect. I recognized that the disease of addiction tends to maintain for me this generally negative outlook on life that is rooted in low self-esteem, low self-worth, fear, insecurity, self-hatred, and a lack of self-acceptance. So I believe that long before I began using, I experienced this emptiness, this kind of loneliness, this void, this darkness in the pit of my soul that often told me that I was useless, worthless, and I would never, ever amount to anything. So living with this experience, I found myself looking for anything outside of myself that would make me feel good or at least complete. So the substance with its mind and mood altering chemicals or properties provided me with the escape I was looking for. And I was able to live in this illusion that said that everything I do under the influence was better. So as time progressed, my life became completely out of control. And I realized that I couldn't do anything without help. So today I subscribe to the disease of addiction, to the model of the disease of addiction, which denotes that addiction is a mental, physical, and spiritual illness, which is chronic, it's incurable, it's fatal and progressive, and it manifests itself in my life through obsession, compulsion, and total self-centeredness. And so obsession is that fixed idea that attempts to dictate, predict, and control my life and behaviors. Compulsion is that inability to stop once I've started. And total self-centeredness are all the ideas, attitudes, and behaviors that justify the fixed idea and encourage the continuation. So I believe that this illness, if left untreated, it will continue to wreak havoc in my life, and the end results are going to be jails, institutions, and inevitably death. So it took me admitting that I had a problem. It took me to recognize and accept that I could not resolve this concern on my own, and I definitely had to seek help from others in order to address the problem that I was experiencing. So today I maintain this, I call it my personal recovery plan. And so what I do is pretty much 6 steps. The first is that I stop using. I complete abstinence from all mind and mood altering chemicals just one day at a time. The second is that I dismiss the idea of self-sufficiency and I get the help whenever I need it. The third is that I stay away from people, places, and things that can drive me back in the wrong direction. The fourth is that I establish and maintain a support system with individuals who believe in me and want to help me through this process. The fifth is that I had to change these negative ideas and faulty belief systems that kept me stuck where I was at. And the sixth one is one that many people struggle with, and I struggled with it as well, was the development of a higher power. And I struggled with that at first. So what I did was my higher power became those individuals that wanted to help me in this process. After a time period, what began to happen was that the higher power became good orderly direction. If you wanted to provide me with something instructional that was helpful, that's what I went with. And today I have a deeper relationship with what I consider my higher power. So it's a different understanding, but as time progressed, things began to change. So for me, in summary, addiction is a complex mental and physical illness that can express itself in ways that are antisocial and make detection, diagnosis, and treatment quite difficult. But the hope is that recovery is possible, but it is imperative that we seek the help that we need.
Thank you. Thank you. Wow. You've definitely showed us or painted a picture of what it looks like. And I think Hamilton, in the beginning, sort of laid some of those building blocks. I have to try to do two things at the same time. One, I wanted to get to Sabrina, where she could talk about the co-occurring mental health implications, which Dr. Al sort of got into, but I did get a text message, and somebody, and maybe Sabrina, you and you and Dr. Al can talk to us a little bit. They're asking what was Hamilton's first use, because I know you gave a lot of information, but that's the question. So, what was the first use for you?
What was the first substance that I used?
Yes.
It was alcohol.
Alcohol. Okay. Great. And that is definitely one of the more common substances. But so Sabrina, we wanted to go to you and to hear a little bit about the co-occurring mental health issues that also come with the abuse.
Oh, yeah. Hi, everyone. Thanks for being here. Co-occurring disorders are two disorders pretty much at the same time. A lot of times we see mental health disorder and drug and alcohol disorder at the same time. So when these people come into the office to be treated, we have assessments that we conduct with them. And in the assessments, we're asking about the mental health and the symptoms and the severity of the mental health. We're asking about drug and alcohol as well. And some of the questions for the drug and alcohol is, did you ever use marijuana? Yes. Are you still using now? Yes. How often are you using? 2 to 3 times a week. When is the last time you used? Yesterday. So this is how we identify if a person needs dual diagnosed treatment. Co-occurring disorders are very, they can look like different things. A person that have ADHD can have the symptoms of a person that's using cocaine. Cocaine, you're fidgety, you're hyper, you're talkative, you can't stop moving a lot most of the time. Same effects of a person that has the mental health order of ADHD, the hyperactive ADHD. I also wanted to talk a little more about co-occurring disorders. At one time was called dual diagnosed. And that was about, I would say it started like 20 years ago. Now we call it integrative systems, where when we work with a co-occurrent client or a dual diagnosed client, we collaborate with the drug and alcohol counselor, the mental health counselor, the physician, PCP, to make sure that the person's meds aren't mixed up or there's no medical issues. So that's pretty much the gist of co-occurring disorder. I also wanted to talk about some of the drugs that hit Reading, Pennsylvania in the last 3 to 6 months. And it was cocaine, opioids, and it was a sedative that they used for animal tranquilizer. Veterinarians use it. I know in September, I would say around September 9th to the 13th or something like that, there was an epidemic of like 101 overdoses. I think there were like 70 of them in Reading, Pennsylvania. And it was in the newspaper. And I even ran into one of the individuals that overdosed. And he said, Miss Sabrina, I was one of those people that OD'd. And I asked him, one of the questions were, what was it that was, usually with opioid addiction, oxycodone, different opiates, the hospital can tell. But at this point, the hospital could not tell exactly what it was. And here it was called xylazine, the veterinarian sedative. I also wanted to say it was one person died, I think, in 101 overdoses, but I know Reading Hospital got about 70 of them. So that was one of the biggest influctuations of overdoses that occurred in Reading. Opioids has also been a big issue in Reading. A lot of people ODing. Fentanyl was the major one that's been happening for like the last year. A lot of people dying from the fentanyl. Fentanyl is an opioid, but it's 80 to 100 times more than opioids. It's the highest level of opiate that you can get. We also have the alcohol that people are still using. Cocaine is a stimulant. What it does, it also, you're energetic, you're talkative, you're euphoric when you use it. But the biggest thing, the main thing in Reading, Pennsylvania now is the fentanyl that is really taking a lot of people out. A drug is a drug is a drug. And there's no worse than the other, but the influx of fentanyl and the veterinarian sedative has been an issue in Reading, Pennsylvania.
Thank you. And that definitely, with the newspaper and COCA and all the agencies, I think the DA also spoke a lot about the opioid epidemic. I know the state has put resources into trying to stop it. And actually, I think Hamilton at the end is going to have an opportunity to maybe give us a little bit even more information on what's out there to help. But I want to make sure we get Ms. Holston into this conversation. I did get a text message saying congrats on starting your own business, which sort of goes the other direction a little bit from what we were talking about, but it just shows you what people were thinking about. Cicely, we've heard about how substance abuses and the I guess the more common drugs are affecting Reading. And what are the treatments or what are how people should pursue help with those issues?
Well, first, thanks, for everybody tuning in, and thank you for the well wishes on the business. But in terms of recovery and treatment, like substance use disorder, it is very individual. There are some, common characteristics, but the journey you take in terms of seeking recovery is not going to be cookie cutter. And that's something that's really important to me as a clinician to communicate to my clients and to their families, because we watch TV and we think that, oh, everybody has to go to inpatient. They watch 28 days and they're like, well, that's what it has to be. That's not necessarily the case. Some people's treatment starts with a detox or starts with jail or starts with the intervention. Some people don't ever seek formal treatment. Whatever treatment is effective is the best way to go, and you won't know until like Al said, to just admit that I do have a problem and I need some help, and just exploring that. That's the first and probably the most monumentous step, to just ask for help. But the traditional, let's say, mode of treatment may start with detox. So depending on what you're using, you may go into a supported setting. Typically there's nurses, depending on the level of detox. If it's a hospitalization level of detox, then there's doctors. But it's just to make sure that you're safe while those drugs are leaving your system. Specifically alcohol and benzodiazepines. I can't stress this enough. If anyone is suffering from either one of those substance use disorders, do not attempt to detox at home. You can die. That is a lethal detox if you're not being medically supported. So there are different medications they'll use to just make sure that you are safely titrating down. So if you call a rehab, if a family member calls a rehab or a treatment facility and we say to the individual, don't stop drinking, they didn't make that up. I've worked inpatient, I've worked at a detox, I work outpatient IOP now. That is absolutely what I would say to a client. Do not stop drinking until we can get you the support you need. So I think that for anybody who's not familiar would think, oh, no one would tell you to keep drinking. No, we absolutely would tell you to keep drinking because we don't want to lose you. Typically detox is, a couple of days, like it could be 3 days to a week, depending on the severity and the substance. And then again, the traditional route, if we're saying the cookie cutter route, would be an inpatient potentially. And that's just to kind of get you out of that environment and to get you, I like to say, just to kind of clear the static. So to get you in a controlled environment and just start laying some of that groundwork. It's not uncommon for people to go to inpatient more than one time. You know, it's a process. It's not something that happens overnight. If someone has to return to inpatient, or if they choose to return to inpatient, because treatment and recovery is voluntary, that's okay. That's all right. You know, you didn't fail because you had to go back. You can step down from inpatient to go to a partial program. So inpatient, you live there, you know, sorry, I made the assumption that everyone would know that. Inpatient, you live there. It can be 2 weeks. It can be long-term, you know, being a couple of months. Unfortunately, it depends on insurance, does not necessarily depend on us as clinicians and what our clinical recommendation is. We will always try to fight to get you what you need and desire, but we don't write the check. So from there, you can come down to like a partial program, or you can do like halfway houses, recovery houses. Recovery house is not necessarily treatment. It's again, a supported place to live. Partial treatment, that is like your formal treatment. You're there all day. It's like a job. I don't know a lot of adults that do partial drug and alcohol treatment, but the most common would be IOP. So when you leave your inpatient rehab, you would go to an IOP, which is what I run. So it's like 3 days a week. You have group for up to like 3 hours. So in Pennsylvania, the ASAM, which is just an assessment tool that we use in drug and alcohol, it says that IOP is up, or at minimum 10 hours a week, I believe. So that's 3 groups, 3 hours at a time, and an individual session. It should be, like Sabrina had talked about, it should be integrative. It should involve nursing. It should involve your primary care. It should involve mental health. It should be the whole person. Because like we talked about, addiction affects all aspects of our life. It's not just some little tiny corner. We have to address all of that. And then you're in IOP for an undetermined amount of time. There's, again, I have people ask me all the time, well, how long do I have to be in here? My answer is, well, you don't have to be in here. It's your choice. And when we assess, I'll give you my clinical recommendation to, you know, if you should, you know, we call it stepping down. But again, I don't make anybody do anything. That's not my job. I'm a counselor. I'm not in law enforcement. And then we step down to just traditional outpatient, and truly outpatient can be any design. I have people that, you know, I see once a week. I have people I see twice a week or every 2 weeks. It really depends on where the person is. Like I said, I try to make sure that treatment is really client-centered and to what the client kind of wants. I'll always tell them what their clinical recommendation is based on my assessments, but ultimately I'm not going to try to force anyone to do anything, because the more I push, the more they're going to push. And now we're just doing this dance back and forth to pushing. I find that how I do things is very effective in terms of just meeting clients where they are, calling them out a little bit on their stories, but just trying to meet people where they're at and finding out what do they really want to change. So that's more of like that formal treatment. And then in that, there's also like MAT, which is medically assisted treatment. That can happen through any of the stuff that I just explained. So you'll have like Vivitrol, naltrexone, Suboxone, methadone. Those are the most popular ones that you'll hear, Subutex, and they're used for different things. I won't get into it in depth because it's a lot. And then there's also mental health medications that can be used to curb cravings. So they're kind of used almost off label, but it's to help with some of those cravings, depending on the substance. Sometimes we'll see clinicians or physicians, I guess I should say, use both. So they'll use an MAT and they're also going to use a mental health medication, and just finding that right, you know, kind of sweet spot. Again, that's why it is so important to have an integrative system working. Some of the informal treatment is just your mutual help groups. So you have like your like secular stuff that is not religious based at all. So that's like Smart Recovery as an example. Then you have your 12-step, that's Al-Anon, Alcoholics Anonymous, Narcotics Anonymous. Then you have more of your religious base, so Celebrate Recovery. And all of those they're anonymous, they're confidential, you know, and you can go in and it's peers. So that, again, these aren't professionals working as professionals. You may see a lot of us professionals in the rooms, but that's not what we're doing when we're in there. We're in there getting treatment. So we're all peers and we're there to have that connection and that support. So, and then you have people who just kind of go a spiritual route. They do seek support from, their church or, their temple or whatever, their God is. And then you have just spiritual in general. So it's not even necessarily church. It's whatever is bigger than the person. And then other things that I had kind of noted here was just, codependency with the family. So like we had talked about just addiction addressing or affecting all parts of our life, it does affect our family. And I know a lot of the times it's hard for family members to realize that it is impacting their life. So, there are supports out there for family members. There's, adult children of alcoholics. There's CODA, which is for codependency. And those are things that I really encourage family members to look into. The problem is the problem, not the person. So if, you're struggling with the relationship with someone who has a substance use disorder, we're not saying that there's something wrong with you as a family member. We're not saying there's something wrong with the person who's a substance use disorder. The substance use disorder is the problem. So getting those supports to figure out how to establish those boundaries. That's one of the first things that goes in addiction or substance use disorder. There's no boundaries. And it's hard to rebuild those, and it's hard to rebuild some trust. So getting those supports for that. And the last note I had for treatment in general was the peer support, CRS, recovery. It is my favorite model. I love it. I think that it's so effective to have somebody who is in long-term recovery linked with someone who is early on in recovery or just wants some support in recovery. It's a different relationship. It is very different than a professional or a clinician meeting with an individual, like, tell me about the week and we're going to process that. To be able to meet with a CRS or a peer support, it's your peer, and you can have real talk with them. And there's not a treatment plan. They're not diagnosing you. It's just real talk. And to be able to kind of compare journeys and get, again, some feedback, some real, unadulterated feedback on, making change. So I think that was everything that I had noted that I wanted to make sure that I went over with the questions.
Yes, no, that was, profound, just all the options. And I think it's important, especially, I think I took away from what you were saying about telling people to continue to drink because of that detox is lethal. That's so, anti what you hear. So I'm just glad you as a professional have said that so that folks can, consider that when somebody gets back to them. And I just think that was very important that you said that. The next question I wanted to get to, and this is for Hamilton, we have defined, the problem or what the issue is. And, Cicely's talked about the treatment. What about some of the local resources we have? And I know you're involved with the Hope Rescue Mission and have taken up a new role for COCA, but can you speak to some of the local supports?
Yes, absolutely. Absolutely. One of the things that I want to share is, from a personal perspective, just about everything that Cicely had mentioned, as far as all of the resources that are here in Berks County, I was a part of. I did inpatient. I participated in IOP, those long hours of group counseling and one-on-ones and sitting up in the office and waiting and falling asleep and complaining, why am I here? And trying to find an easier, softer, gentler way out of this and trying to do it my way. It took me a few times. But once I finally got it and I put everything to the side and I said, this is my job. My job is to get better. My job is to get better, and I have to do whatever it takes so I don't continue down this vicious cycle, ending up in prison all the time, getting DUI after DUI after DUI and, domestic violence charges, because I had that too. I'm an open book. I let everybody know. I don't hide anything. There is so many resources here in Berks County, and I would encourage each and every person to take advantage of that and make that decision. Make that decision to just do the work. Do the work. So to answer your question, Mr. Butler, there are so many different resources here. You have obviously the hub, COCA, Council on Chemical Abuse. If you go to their website, which is cocaberks.org/hope, that is COCA berks.org/hope. All the information is right there. Everything you need to know, where, the who's, the what's, the when's, the how's in Berks County, you can go right to that website. Hope Rescue Mission, that place is very dear to me. You know, I worked there as an entry-level employee working at the front desk. Got my certification as a CRS, like Miss Holston mentioned. And I agree with you. Major part, because a lot of times, like a person like myself who was early on in recovery, trying it several times, what clicked for me was when I sat down with somebody who was a CRS, somebody who walked the walk, somebody who's been down the same path, somebody who spoke the same language as me, and somebody who, quite frankly, will give it to me the way I need to hear it. You know, and sometimes I need to be talked to a certain way. I don't encourage that, but sometimes that's what worked for me. And as a result of that, I was able to take my ego, put it to the side, and be open-minded enough to listen and receive all the information from anyone who could give me that experience, strength, and hope, whether it was peer or whether it was from a clinical perspective. So you have COCA, you have the Hope Rescue Mission, you know, you have Easy Does It Incorporated, that's a recovery house. The YMCA, great place. I was a resident at Camp Joy when they first opened back in 2009. You know, Camp Joy laid a real solid foundation for me. So big shout out to them. And, you know, again, I would encourage anybody and everybody, just go to the COCA website, cocaberks.org/hope. All the information is right there on the COCA website. And COCA stands for Council on Chemical Abuse.
Okay, thank you. I've always gone by the Hope Rescue Mission, either drop items off and, you know, notice the men going in and out, and often wondered, you know, what services they were providing besides, you know, putting a roof over their head. And I had no idea it was as depth as what you were saying. And it's great that they employ people that also have, you know, used the services and are able to actually help other folks that need the help. So I'm also a fan of, you know, trying to make everything work together. And as you know, Sabrina was saying, integrated and get people in the field, because, you know, no one person has all the answers. So I really appreciate that.
There's one other, and I also forgot to mention TASC, TASC. They're on 6th Street. They have that's where it all happens as well. So TASC right on 6th Street. I think Sabrina wants to maybe share or touch a little bit on that. I saw her hand raised up. Should I kick it over to Sabrina?
Yes.
Thank you. Yeah, TASC, I was going to talk about TASC. Sam's is right next door to TASC, upstairs. I also wanted to talk a little bit about codependency enabling. If a family member or a friend is having an issue with drugs and alcohol, sometimes we love them so much that we'll take on their responsibilities. And what it does is it just helps them to continue to use, because they really don't have accountability, you know. And usually, you know, it could be a friend, it could be a partner, it could be a family member, it could be someone that's emotionally attached to the individual. And this just came up in my mind. Sometimes we can love people to death, you know. And I'm gonna give you an example. Some people will rather give the addict or the person money so they don't have to go out in the street and do whatever is necessary to get the drug, thinking that that's going to help them, you know, stay safe. well, as an addict or a user, I'm telling you from my personal experience, I would take your money and I would go back out and get some more money as well. So it's really important to understand enabling is doing for an individual um, that has, it's the unhealthy way of helping the individual. And in order for the individual to get help, they need like a healthy support. Sometimes just saying, no, I cannot give you the money. No, I am not going to let you sleep here. No, I am not going to. That is called tough love that some of us need. And
Mm.
once you start doing that, I know for me, in my personal experience of recovery, it made me be accountable for myself.
Yes, that is so important. I work in the school system. Actually, I a little bit remiss because I don't think we mentioned anything about young people so far along the way. But I want to give somebody opportunity to talk about maybe, I think, Cicely, you deal specifically with youth and part of your job, but that codependency and parents trying to help kids and older, when I say older adults or younger adults, and thinking that, like Sabrina was saying, give them the money or taking away some of their responsibilities so that, in their mind, they can receive help or go and get help by not holding them accountable actually makes the situation worse. So I really appreciate those words. But Cicely, you want to talk a little bit about dealing with youth since we didn't get a chance to specifically talk about them?
Yeah, sure. So in my job right now, I work with all age groups. So from 13, it's probably like my youngest client, 13, all the way to, 80. It's the whole age group. When I did work specifically with at-risk youth, unfortunately, the options that we have for like adolescents in terms of like more of a higher level of care inpatient is really limited. You have Cairn Foundation, which is excellent, but they accept only private insurance, and all of the people that I worked with when I was working with at-risk youth all had medical assistance. That wasn't an option. For like, there is a place in Lancaster, but it's specifically for males, and I don't think we have any inpatient female adolescent facilities. And I could be misspeaking, but I don't believe we do. There was a couple of places, but they've since closed. Some of it's closed because of COVID. Some of it was just that they had to they had to use those beds for adults because they just didn't have enough adult beds, and the adolescent beds weren't necessarily being filled. So my recommendation for any family members who think that their youth has a substance use disorder is to try to encourage them to get into treatment. Unfortunately, the youth can decline treatment. You can't force them into treatment. However, if they are just willing to talk to a counselor for a couple of minutes to just, why do you think mom and dad are stupid and that you don't have a problem using drugs? Like, just get, to have them have that real conversation with the counselor and allow them to have that conversation with the counselor on their own. You may be surprised. I do have a couple of clients that were absolutely like, this is stupid. I'm not doing this. I don't have to do this, yada, yada. And I said, you're right, you don't. So we can end now if you want. They still come back to me. When I went on a leave for, medical leave, they were like, when are you coming back? I want to see you. So they started out being like, no, you're dumb. You don't know what you're talking about. I'm fine too. They really did just need to talk to somebody. And they wanted to do that. I never at any point forced them to do that. So I encourage just family members working with youth specifically, even adults. You have to respect people's autonomy. But, I understand as a parent of a teenager, God forbid, I would probably myself, like, you're doing everything. You're going to the highest level of care. I'm going to send you to Florida. You're going to go inpatient. Oh my goodness. That's probably not going to be the most effective. Just be there to listen and get the supports that you can and let the youth be heard. And try to get them into to some kind of like treatment. They can do IOP, they can do partial, they can do outpatient. There are a lot of resources still. Task can still certainly help with that. So they'll do that assessment, do a recommended level of care, and then they'll kind of do some of that legwork for you as parents to try to find a facility. So they'll have that list of who, who has beds, who, treats that specific population. But intervening early is probably the best. And I guess, silver lining is a lot of the times with the younger the youth, they may not necessarily be tissue dependent at that point. It may be something that is more behavioral, and the substance use is the shiny object. So meaning that may not be the thing that needs that intense attention at that moment. Because I think some of the stories that we did hear were about there was a hole, an emptiness, a pain, a suffering, and anger first. And then people started treating that, like self-medicating that with a substance. So if we can intervene early and address some of that stuff, whether it be trauma or just adolescent angst or what have you, to just address that and not be necessarily distracted with it has to be substance use treatment. It could be just mental health treatment. It could be behavioral treatment. There's a lot of different stuff out there for that. So if it is a mental health thing, Sam can certainly help with that. Tess can help if it's drug and alcohol, but don't worry, because they'll navigate you once you're on the, I guess it's like the third floor, I think, second floor. I should know, I work there. They'll navigate you as appropriately to make sure you get assessed and get to where you need to be.
Thank you. Self-medication is the one I run into the most, and it, combined with the already mental health situation that was going on, that is a biggie. But what I want to do is change gears a little bit, because we've talked the whole gamut, but we've not really talked about how you maintain recovery. And I have to say, Sabrina, Hamilton, and Dr. Al, the thing that really, really impresses me is how you've come out of it and you're like flourishing. And maybe that's my take on it, but maybe, starting with you, Dr. Al, we could talk about how to maintain the recovery and, not just survive to thrive. And maybe you could talk a little bit about that for us.
Yes, thank you again. Maintaining recovery for me became an ongoing process. It's not something that, okay, I stopped using and it's all over and I'm good now and I can just move on with life. The using became my life. The using was something that I needed to do consistently, frequently. It helped me to, it gave me that thing that made me feel whole and complete. And I had to replace that with something else that helped me to become whole and complete. I have this concept that says I can't change a behavior without replacing the behavior with an equal behavior that gives me the same thing that I was receiving from the previous behavior. And so it comes from this concept of behavioral therapy, which says that anything that I do that gives me a reward, I'm going to continue to do it. Mm-hmm. So I needed to find something else that was giving me the same reward. So I found an outlet. Now, again, we've talked about this many different ways to recover. There was the religious to spiritual. There was the different types of MAT programs and a number of different things that we can utilize. But for me, what I found that helped me and was beneficial was a 12-step outlet. And so the 12 steps provided me with this, what we call in the field, we call them we call them coping mechanisms, coping skills. But in the program, we call them spiritual principles. And these principles were guiding principles that helped to enhance the quality of my life. And as I worked through the program and worked through the step process, I was able to begin to grow and to flourish. And so it was necessary that I got myself a sponsor, I got a home group, I made meetings, I worked the steps, I stayed involved. Under any and all circumstances, I refused to use, and I had to develop a relationship with that God of my own understanding. And so utilizing this script was what began to give me the freedom that I needed. And so the step process is something that once, at first, it seems like it's an academic process. Now, I appreciate academia. I've been to schooling for 12 and a half years. So yes, I love me some academics. So I was able to jump into it knee deep. And so as I worked through this process, I was able to learn and discover more about who I am and who I had created. And I had created this individual to protect myself from the amount of pain that I believe that the world will inflict on me when in reality I was inflicting the pain upon myself. So I needed to start dropping these walls, these resistance that I had to protect myself, and I had to find an outlet. So through that process of developing that program and working through the program, and I didn't actually develop the program was there when I got there. Since 1952 or something like that, the program was established. So I just jumped in knee deep and found that this program, if it worked for them, it could work for me, which is that fellowship thing that we identify with the peer support, the CRF. Those individuals, they're individuals that have gone through the process and they can help you and walk you through the process. And that's exactly what I found by joining the fellowship, becoming a member. And today, listen, with 19 years clean, I still make meetings. I still work the steps. I still stay involved. And I don't throw in the towel on any of that stuff, because if it worked for me 19 and a half years ago, why wouldn't it work for me now? So it just makes sense to continue in that process. And so we live with something that is chronic, incurable, fatal, and progressive. And if left untreated, it's going to wreak havoc in my life and make any attempt to veer me back to the same direction that I was once in. Keeping that clear in the forefront of my mind keeps me moving forward and doing the things that are necessary, which is I had to select a program of recovery, practice that program in daily living, and don't change the script. If it ain't broken, I'm not fixing it.
You got to unmute your phone. There you go.
Yeah, sorry about that. I'd say that was almost a mic drop from Al there, but is there anything you care to share in terms of how you maintain your recovery?
Dr. Figueroa, thank you for sharing that. And he pretty much told my story as far as where I'm at, and what I do. I have a sponsor. I've chosen the 12-step pathway, and also the spiritual pathway as well. So I do a little bit of both. I do Celebrate Recovery, and of course the 12-step recovery program of Narcotics Anonymous as well. But I have a sponsor. I have somebody that I call on a daily basis. I do service work, and like Dr. Figueroa had shared, if left untreated at any given moment, the disease of addiction will sneak up and manifest itself in any person, place, or thing. It does not care who or what it uses. In fact, this year has been one of the roughest years of my life. I lost both of my grandparents within 3 months. I then became sick, and I found myself getting very depressed just this year. But no matter what, I didn't use, and I utilized those tools that were given to me, and I did the work that my brothers and sisters continue to encourage me to utilize to help me get through it, because at any given moment, the disease will sneak up and try and take me out. Now, I just celebrated 7 years, September 27th of this year. My pop passed away September 4th. My grandmother passed away the Sunday before Mother's Day. My grandmother is who raised me, and I would always say, man, I don't know how I'm going to react when my grandmother transitions. And this year was very challenging for me, but you know what? I didn't use. And I picked up the phone. I picked up this heavy bad boy right here. And I called people and I called people and I called people. I called my sponsor. If I couldn't get a hold of him, I called somebody else. If I couldn't get a hold of that other person, I called somebody else. And what I did and what I continue to do is I open myself up. I allow myself to be transparent. I don't hold anything back. I let that individual know exactly what I'm going through and exactly what I'm feeling at that moment, because I'm told that secrets will keep me sick and it will fester, and it's only a matter of time before I start getting bright ideas in my head. Well, maybe if I do this, or maybe if I do that, or maybe if I, like a couple girls' pictures on Facebook and slide in her DM, and it all starts with that thought, and I put it all out there. This is what I'm thinking, and one of the things that I say, and I'm very open. I'm very open about what I'm going through. If I'm going through something, and when I'm going through something, I will call somebody, and that somebody is a man. I will say, listen, this is what I'm going through. This is what I'm feeling. And please, I'll say, this is what I'm going through. This is what I'm feeling. And I'm thinking about doing this, 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 and this. Do not hang up until you talk me out of it. And
Wow.
I explain, and I let them know exactly where I'm. This is what I do when my behind is on fire, as we say. I'm an open book. This is what I'm feeling. This is what I'm going through. And then I just spill it all out. And then I'll go meet with that individual. We'll have some coffee. We'll go to a meeting. We'll go to church. We'll go to both. I have a therapist today. I still go to therapy. I have a therapist. I hired a boxing trainer. So that's been helping me out. So I just added little extra things into my lifestyle to kind of turn things around and help me get uncomfortable, so to speak, because that complacency is also the enemy too, because it's very easy for us to get comfortable and complacent and be like, oh, I'm cool, I'm good, I got this. I celebrated 17 years, I got 19 years, and I'm accomplished and I'm good. I don't need to go to any meetings. I don't need to call anybody. I don't need this anymore. I got this. No, I don't, because life is going to show up and punch me in the mouth at any given moment. And I have to be on point every time. And just like Dr. Al talked about, I have to utilize this. It doesn't stop. If it ain't broke, why try and fix it? I had to trade in those bad things with the good things and become, I don't know if this is a good word, but become pretty much obsessed with that. And it's very easy for me to get comfortable and say, oh, I'm good. Bank account's good. And, I'm working from home, and, I'm living my dream, and, I'm married and got a couple of dollars, and, skin's looking good in the light. I don't need to go to a meeting. I don't need to call nobody. But what I'm starting to say is, the language that I'm starting to use is, I'm starting to think that I'm God. I'm starting to think that I'm taking my will and my power back, and I don't need anybody else. And automatically from that moment on, I am in relapse mode. And I got to be careful with that. I got to be very careful with that. So
thank you. And Sabrina, I don't want to leave you out on this. Like I said, you seem to be thriving. And can you give some words of wisdom of how to maintain?
I wanted to just pretty much say ditto to both what Al and Hamilton shared about recovery. And this year was a tough year. I think a lot of people had some issues going on this year. And what I do is I try to balance out my life. I go to a fellowship for my spiritual aspect. I do recovery meetings. As a matter of fact, I had to go back to the basics of chairing meetings in my home group again. Because, and I'm telling you the truth, I missed going to meetings through the pandemic. I missed it. And you just don't know how important it is to have human connection to people who know exactly how you're feeling and what you're going through. So it was the love and support of, the fellowship, of the other fellowship that I go to. A lot of things popped up. I had to try to keep balance in my life with the fellowship, attending the meetings, with the fellowship that I practice my religion at, with family, with my own self, taking vacations and, making sure that mentally I'm okay. I had to just do like a self-care assessment and balance out my life to find out what I'm lacking in and what I'm not lacking in. So what I'm lacking in and what I'm doing okay in. So that's pretty much what helped me this year.
Thank you. I really hope folks were able to take those three basically descriptions of recovery and maintaining it. I guess the only thing that maybe ask at this point with Cicely, is there anything that the counselors would say, to folks that are at this stage of their disease, or how they've controlled everything?
I think that they all, hit everything like, right on the head. And again, it's their own journeys, but they all have similarities. I think that the biggest thing is just remembering it is lifelong, just like Hamilton said, like not to be complacent, and a lot of just that honesty with yourself, like just self-inventory, self-reflection, being okay with being transparent in your safe space. It does not mean you have to walk around with a t-shirt on that says, I have a substance use disorder, but to be able to find that those safe people, have that connection. Connection's probably the biggest thing to make sure you do maintain, to avoid going back to that stinking thinking. We tell our clients, especially the ones who've been in IOP for, let's say 3 months, and they're like, I'm good. I don't have any cravings, because we do check-ins every day, last use craving, they're like, none, it's great. Everything's great. I have a job, blah, 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 blah. Everything's coming up roses. And I'm like, okay. And that's awesome. And I'm so happy to hear that for you. But remember that your substance use disorder is doing push-ups in the parking lot while you're in here doing this work. So the minute that you slip up, it comes right in like, hey, I got an idea. And just like Hamilton said, and I love that he said it takes the form of a person, place, thing, however it can get in there. So you do kind of have to be on guard all of the time. And I think just that self-awareness, being honest with yourself first, that's just going to keep you to hopefully be doing the right thing. And being, like I said, just being honest and having at least one person in your life that you can be completely transparent to. They're not going to judge you on it, but they can certainly help talk you out of some of that, those thoughts, like, I'm thinking I'm going to do this. And they're going to be like, yeah, that's a dumb idea, and this is why. Or even people who know before you tell them, like, you don't even have to necessarily say it, because, when we're starting to think in reckless ways, I guess you could say, we move different. We say different things. We're, the way we dress. I've had clients that they knew that they were starting because they stopped making their bed. So if they stopped making their bed 2 days in a row, they knew they had to call somebody. It was little things like that. And those are the kind of things I work with my clients on. Like, let's back up before we even get to the use or even thinking about using. What are some of these things that if you stop doing them, maybe it's time to reach out to somebody? And that's the kind of like deep self-honesty that I really encourage. And again, being connected to somebody else who sees that in you and can, will call you out on it, and that you'll accept it and not right away be like, you're stupid, you don't know what you're talking about, So, but I think that they all, kind of said that same thing, just in different ways. So I just said it a fourth way.
Well, thank you. And that's what this whole thing is, to try to reach as many people. If we can help one person, this was all worth it. So we always, we're getting ready to wrap up, but we always give everyone the opportunity on the panel to give your social media or how people can get in contact with you, because each one of the panelists in all the other sessions has had somebody come to them afterward and say, hey, I didn't know that that's what you did, or, something you said moved me or whatever. So why don't we allow everyone, and starting with Dr. Al, how people can get a hold of you, your social media, or how you want people to contact you if they're interested?
Well, I provide my phone. My phone has been in our community for 17 years. I still have clients from years ago who call me and identify my phone number and say, wow, you still have that number? Yes, I do. It's 610-698-5679. You could leave a message there and I'll call you back.
Okay. Sabrina?
The whole Reading knows me. No, I grew up in Reading. I was born here. Yeah, I provide my telephone number. My number is 484-529-8256. If if nobody has it. But I'm quite sure 80% of Reading has it.
Okay. Cicely?
Well, so you can find me with phoenixwellnessllc.net. And my business phone number is 484-222-8282.
Okay. And last but not least, Sir Hamilton Newton.
Pretty simple. www.sirhamiltonnewton.com. www.sirhamiltonnewton.com.
Thank you so much. I really, really was excited about being a part of this group. I know that substance abuse is, we have a large community in Reading of folks that are either, maintaining recovery, helping folks, providing the services. People come to Reading for this because they know what is here and what's provided. So I thank all of you for being a part of the community, sharing your time tonight. We hope that folks will share this out. I know with the other 3 sessions, we're well over 600 or 700 views on those sessions. And that's probably thanks to the mayor and his Facebook page. So we want to thank him once again. And also the Lonnie Walker Foundation and the African American Connections for my beautiful wife for having the foresight to go to Eddie and Eddie agreeing to do this. And I'd be very, very remiss if I did not mention Christian Crespo, our communications person, who's very instrumental in getting us on the screen and making sure that you can hear us and see us. Thank you so much, sir. You are a class act, and work with you anytime.
Mm-hmm.
But thank you. Have a great holiday, and please enjoy yourself and stay safe. And thanks again, and enjoy yourself. Good evening.
Thank you. God
Good
bless you.
night.